Now, if you decide to go on milk test and start actually keeping records and having your milk tested by an independent lab, they will tell you whether you're looking at an infection brewing. There's something called a somatic cell. Somatic cell counts are actually counts that are indicating whether or not there's an infection. Now, most somatic cell counts are geared towards cattle, and goats have a higher level of somatic cells than a cow does. But you can look at a DHI report and see whether or not you're looking at an infection level or not. If you are, then chances are you're not feeding a balanced ration. You're not keeping things as clean as they should be. The animals aren't getting all the minerals that they need to have. And you could do better. And your animals would do better, and your somatic cell count would be lower. Okay? So you have it in your control if you choose to take those steps. Now, getting back to tuberculosis and the timing of things, excuse me for the digression. At the same time that we were looking at refrigeration, we were also looking at factory towns and people living in close quarters. From my work as a history ranger at historical parks, I know that tuberculosis did go through tenement areas. They did go through worker spaces. That's because it's airborne. And a cough would do that. People who work in tight quarters, people who work in places without ventilation, people who live in tight quarters with other people, tuberculosis spreads. Now, if you are the government, and I'm not casting aspersions on anybody, I'm just stating it as I understand it, you want to stop disease, but you don't want to stop the economy. Do you look at growing a dairy industry and using the safeguard of pasteurization? Or do you look at growing thousands of individual small dairies and trying to maintain safety on that? Well, the decision was made that they would look to foster the American dairy industry and not the individual small farmer. So the government has made it difficult to sell raw milk. In some states, it's easier than other states. It is getting easier as more people recognize the difference. If you are a raw milk dairy, you must keep a level of sanitation that is higher than if you were being a pasteurized dairy. Because you do not have that safety event, you do not have pasteurization to kill the germs. You do, however, have a better product when you're done. So you have to decide what level you want to keep things at. And if you want to sell, you will need to have a dedicated milk space, a space away from the main barn, a dedicated room where your milk is handled. You will need to have some sort of cooling system, which can be just as simple as putting it in a vat of cold water. You don't need to have a whole refrigerated tank.